I think given the risks of the kind of caseload we work with, anorexia nervosa has the highest mortality rate of any psychiatric condition. So there are a lot of physical and psychological risks that we're managing, but actually being in a team that can contain and support you, it feels really nice and safe.
So it made us quite a unique team in that we built a new network that came together to undertake the challenge of transforming on a large scale.
So this is a service that's providing public health care to 250,000 families each year. That it provides that through 600 staff working together across the whole of Leicester, Leicestershire and Rutland. They're working with local authorities, working with health services, a really multidisciplinary environment. And to work on that scale and to transform a service, truly transform a service on that scale is a really special thing.
I think for me, they always kept in mind that we're not the team that are on the front line with those patients, but we are the team that support those teams out there on the front line. And they worked really hard to make sure that those nurses and those prescribers, their concerns were heard and they were brought back to the people who could fix those things for them to make sure that they were still able to deliver the care that they needed to.
The fact that they've remained confident, they've remained passionate, and they have supported each other as a team of matrons has been mightily impressive. I've worked in several NHS trusts before, and this is the first time that we've seen a brand new team come together a week into post and try and lead and deliver a transformation the size of what we're attempting to do here, and actually who genuinely believe that what they're doing will make a difference.
We've got a really fantastic MDT, and our assessments are really structured in that way. We have input from the family therapist, nursing, psychology and psychiatrist. So there's a really nice holistic way we view and work with the families in our team. When I started in August, I just kind of clicked straight away. They were really nurturing, and I think given the risks of the kind of caseload we work with, anorexia nervosa has the highest mortality rate of any psychiatric condition. So there are a lot of physical and psychological risks that we're managing, but actually being in a team that can contain and support you, it feels really nice and safe. The team kind of always impressed me with their participation and involvement from families and carers. So we have a parents and carers group that's run monthly, and that's facilitated by expert parents who've kind of been through the service and have been on the journey with an eating disorder. We're looking to expand that as well at the moment, so we're looking at getting a telephone support line. We're looking at setting up a participation group for young people, so really getting their input in what they would like a group to look like. We get a lot of feedback, so we've taken lots of feedback that's kind of gone into how our waiting room looks, the cushions, decorations, because sometimes families can be waiting for a while in there if they've got a young person being seen individually. Last year the team looked at improving access to BME communities in Leicester, Leicestershire and Rutland as well, and they did that by kind of going out to GPs, school nurses, and doing training to them and presentations. And as a result of that, we ended up seeing referrals from those communities increase by about 11%, which was fantastic. And we recognise the need to keep doing this, so we're going to be sending and kind of posting out more leaflets to GP surgeries and kind of those areas of high BME populations. For the Eating Disorders Awareness Week last year, the team did an audio kind of podcast series of a young person's journey through the team having an eating disorder and kind of their journey through recovery, and that was an audio podcast, and that actually, I think the team got 37,500 views off that, which is amazing. So really helping to raise awareness, and that's why I've nominated the CAMHS Eating Disorder Service for Team of the Year.